Today, I'm so excited to be sharing the success story of the state of Kentucky's local health departments and how CADA, the state, and all of the local health departments came together to create the first of its kind local health department public library. The three goals and phases of this program through AOS was number one, let's bring together all the local health departments to buy a survey software as a group so that we could significantly reduce the price. We were able to get it about half the price. Second, that allowed everyone to share our measurements like baseball cards, something that we've never been able to do. Two, it created a state level librarian within the state so that all of the survey templates could be found by all the local health departments in one common place, and we could stop recreating the wheel. And third, hold a monthly meeting of those measurements so that one, we could present the measurements that we found, two, allow local health departments to ask for measurements to stop reducing work. The state joined the effort, the state association joined the effort, and it's really been the leadership of the entire state. And this video and interview by Dana is to help other state associations and other state health departments understand the great work that the LHD Academy of Science is doing across the nation. And we couldn't do this without the LHD Academy of Science board, made up of all the other state AOS states. So appreciate it. Without further ado, here's the interview from Dana. Thanks.
Sure. My name's Dana Nickles. I'm the executive director of the Kentucky Health Departments Association, and we are the SACHO, the affiliate, the state affiliate for NACHO in Kentucky. We are comprised of local health department directors from all 61 health departments from across Kentucky. All of the directors are members of our association.
Tell us your AOS story. How did you get involved? How did you hear about it?
Yeah, so I first heard about AOS at a SACHO meeting. So we have a group of people who have my job across the country who are supported by NACHO. We call ourselves SACHOs, the state associations, and we have a very active group. We meet monthly, and usually about twice a year we meet in person. And so at one of our in-person meetings, you, Jake, were there talking to us about AOS. And so I came back to Kentucky and told my leadership about this great project that I'd heard about at the SACHO meeting. And I knew that, not being a data person myself, I knew I wasn't the person, to be the lead, but was able to work with our leadership to recruit the appropriate people here in Kentucky to lead the effort. And through Jake's leadership and assistance, it has grown each and every month since we started, I believe. But, those first meetings, I was the point person, but, we quickly figured out that we needed to pull in some expertise. So we were able to do that. One person that we have on our team, leading our team, works at the State Department for Public Health. And then the other person who's very involved works at a local health department here in Kentucky.
Knowing that the 61 local health departments measured differently before this effort started, why did you feel that was important to kind of have a brain share of different measurements and really try to come up with the right way of measurement? Did you have leading the SACHO kind of think that was important?
So we meet monthly. Our SACHO meets monthly, and so we have very, very good attendance at our meetings. Now we do a hybrid, but we have close to all the health department directors in the state meeting with us monthly. And so over the months, I just kept hearing, at different meetings, this pain point about data and about how the local health departments do report a lot of data to state and local government, but have a lot of trouble kind of getting that data back. And then also maybe the data, the timing of when they're able to get the data reported back is a problem. So like if there's an outbreak, they might find out about it 6 months later, the details that could have helped them in responding when it was happening, much earlier. And so just those kinds of things kept coming out. Like I said, kind of pain points. And then just knowing that the various local health departments in the state were collecting their own data for their own use, but the way they were collecting it, maybe the questions they were asking were not exactly the same. And so it wasn't data we could extrapolate, and attribute to local public health across the state. And then this was exacerbated when we had legislation that we led through my organization in 2020 with some partners. That was public health transformation legislation. And so as part of that legislation, each local health department in the state is now required to do a community health assessment, where before that was really only being done by local health departments who were pursuing accreditation, which was only a handful. Although we do lead the country, we're one of the leading states in how many health departments are accredited, but still it's a small number. So this new requirement in the law that we got passed, gave us the opportunity to really kind of standardize this data that we're collecting across the state. If everyone was going to be doing a community health assessment, we thought we should be asking the same questions in that process so that we could then use the data. Also, as part of our public health transformation legislation, there is a funding component. And to sustain our funding, each and every budget cycle, we're going to have to demonstrate to the legislature why, what progress we're making and why they should keep funding us. And so we saw quickly we're going to have to be able to aggregate our local public health data in order to be able to make that case every 2 years. So those are really the drivers, I believe. And it was not a hard sell for our state, for our local health department directors to get on board. We had some early adopters, and really, the project spoke for itself. So I didn't have to do a lot of talking anybody into anything. People were quick to offer up their staff, like Elizabeth Pointer, who is our lead here in Kentucky. She works at a local health department. People were quick to offer up their staff to be part of it and to help out. We've had a core group now for many months, but we're continuing to build. And so, that is an effort to kind of reach out to some outliers, or maybe to some of our smaller local health departments who have a lot on their plate, especially in the COVID era. And so, we were lucky that our State Department for Public Health was able, through Carrie Konya's kind of insistence, was able to locate some funding so that there's actually not a cost anymore for local health departments to be part of this effort. We found that was a barrier, the cost, especially for small rural local health departments. So really, it's just been getting the right people to the table, and that's how we've kind of gotten rolling here.
Prior to organizing the AOS group in Kentucky, it was commonplace that local health departments would create these measurements and hide them in random logins and never share them or put them in a common library. Why is measurement transparency such a pivotal, so important to health departments in Kentucky and sharing measurements?
Yeah, so there's a few different things. I don't think it was anything intentional. I think it was just there really wasn't collaboration in this area. As a general rule, our health departments are more than happy to help each other, to share with each other. It's just that there had not yet been coordination in this area. So we have some health departments who have staff who are trained in this, who have PhDs and all the things, who are very skilled in collecting this type of data and doing the measurements. And then we have other health departments who have no one, and so who has that expertise. And so, it really helps to be able to share the expertise statewide. And like I said, we do have a spirit of cooperation between our local health departments. So it was just a matter of capturing that. And then what we've also been able to do through some of our NACHO mini grant funding and other ways also is to bring in expertise from our colleges of public health. So like the people who teach these really smart people who now work at the health departments are helping us. And so it's just, I think what AOS has done is really just helped us to get organized and to help us just kind of start collaborating in this effort. in this area where we were not collaborating before, but we had all their tools and resources, we just weren't putting them all together.
Right. Yeah. I love that. I mean, just working together, I've seen that culture throughout all of Kentucky. And
And
it's
there's
just
so much more we can do. I mean, it's just, it's just going to be incremental. It's going to continue to grow. I feel sure.
it,
Um,
you talk about the culture, and I would echo that. Just, hey, we used to hide this, and now we're a team, and hey, we're committed to it. Another value of the Academy of Science is being that the group is technology independent, meaning we use the best technology that available that the group decides on, but we don't want to be in separate tools, so that we can trade like baseball cards. Now that they're all in the same software, and we can, why is technology independence, just all working together, important?
So I think that it has been helpful in AOS for all of us to be using the same software. And like I said, I'm not an expert on how everything works, but I do know that because we're on the same platform, we're able to bring in training for one thing. So as I mentioned, some health departments, we have the health department director who wears many hats, who's also doing this function, because they may only have 3 or 4 staff members altogether. So to have one platform or one software that everyone is using and everyone's agreeing on using and committing to helps, because again, we can share the expertise, but we've also been able to get some funding to do training, which then kind of raises all the boats, right, in this area. And it also allows somebody in Louisville who may be super skilled, or somebody in Lexington, to help a health department director who has not done this work before and who is now assuming it, kind of get up to speed and understand how to use it. It's my understanding also that we're able to house all of our information in this one place, and then that allows others to use the great work that may have been, that someone may have spent a lot of time and energy and expertise and knowledge putting together, can then benefit a multitude of people in different local health departments.
Having a state level librarian has been key, so that we can look at what exists, and hey, let's just give you a copy of it and here you go. So yeah, it's a big.
Well, and I mean, and just to answer a question you have not asked, I mean, really, at the end of the day, we have some poor health outcomes here in Kentucky, and so that's the whole point, right? I mean, we're doing these community health assessments, we're gathering this data so that we can try to improve the health of our people. So, I mean, that's why it's important that it be shared widely, and we have this spirit of everyone getting along, because we all want the same thing.
Another value in AOS is that every health department matters. When forming AOS, it was larger health departments, the larger 50 across the country, and they could have easily gone out and just decided, hey, we're going to create the measurement, and we're the haves, and be able to leave those others behind. But they didn't. They strategically said, look, we really want to make sure we serve and strive to serve the underfunded local health departments and not leave them behind. And we've worked to reduce costs by buying a software in bulk that the group decides on, but then also going after state grants or CDC grants, so that we don't leave these local health departments. Why is that value of every health department matters and gets to be at the table when working on measurement?
Yeah, I mean, I hear the local health department director say all the time, what happens in this town over here affects me over here, because we don't live in a society where everyone stays in their county and their home and their community. So people move around. So, that's not exactly an answer to your question, but, I feel like everyone's invested here in Kentucky in everyone being healthy. So it's not just people in this town or this city. I mean, a lot of what we're trying to do in our association and our state department for public health and at our local health departments, is to improve everyone's health. So being able to use this data and this way of collecting it and to build expertise at our smaller local health departments because of these tools and because of being able to work with, people who have more degrees or more experience, I mean, that helps everyone. So, I mean, that's why we do it here in Kentucky.
AOS believes that the members should make the decision on what software the group decides on so that it's member decided. It's not, we use the software that our brother-in-law sells, or, there's some collusion and whatever. We've organized the buying committee to look at the software, and it's reduced the price by half. Why should we follow good government practices in the procurement of software that we use as a group?
So, I mean, I think that local health departments are the end users here. So allowing them to make the choice of what works best for them and what meets their needs of what they're trying to accomplish through AOS. I mean, I think that's the way it should be. Just letting those who are going to use the software decide, what's the best thing, I think makes perfect sense. Also, I mean, having worked in government myself, I mean, and in our case, there are state dollars at play here, because the state is paying for local health departments to be able to access the software. So basically the state's paying the fee for the software. That demands, I think transparency and, just following the principles and ethics and guidelines. I mean, I think that's a no-brainer. That's in Kentucky, we would definitely need that to be built in order for our folks to be on board.
Across the state, you have 61 local health departments, but across the nation, we have 3,585. It's crazy. And to think philosophically about what it's like to be a citizen in the United States and to consume health data, and going, okay, wow, there's 65, there's just all these different data sets. Why is the future of local public health coming together to try to help these citizens understand their health data better?
So I think of local health departments as the boots on the ground. So they're the people at local health departments are the ones interfacing with their communities. I mean, here, we consider our local health department directors our chief health strategists for their community. So, they're in the best position, I believe, to help citizens understand health data, to help them understand what does this mean, or, how can this data that we're gathering help our community, help me as a citizen, help me as a customer of the local health department. So I think it just comes down to, I mean, the local health department employees are the ones who are going to be talking with someone about their WIC benefits, or talking with someone about the diabetes prevention program, or, any number of things that happens at a local health department. So I just think that they're in the best position to do the educating and to explain to people what it means and why it matters.
Would you have any advice to a new local health department data collector? They're newly hired. They don't get to attend KHDA meetings, but they've been thrust on them. You're in charge of collecting your county's local health data. That is such a heavy burden, a responsibility to report the community health assessment for the year. Would you have
especially if they have 3 other jobs, which is normally the case?
What advice would you have for them?
I would say call Elizabeth and Carrie. I would say call our leads here in Kentucky, because, I think that's one thing that has been really interesting about the AOS project. And we had a data day in Kentucky last year that I got to attend, and I got to be with all of our, different people in Kentucky and the local health departments. And it was great. I mean, just to see that seemed so helpful for them to have a network of people that they could go to and ask questions, or even to figure out, like, why does this matter? And, why is this function of my job so important, and to be part of something bigger. I mean, yes, it's very important in that community, but it also contributes statewide. So I think it just helps to, helps the person to know that they're not alone. They do have colleagues who are doing the same work as them, and who have the same challenges that they do. And then really just somebody who speaks their language. I'm sure that they're used to dealing with people like me, who don't know exactly what they do or how they do their job. So to be with kind of people who have their same expertise and skill set, I'm sure is helpful. And to have contacts, throughout the state, that they could reach out to, and just to be able to contribute, to a bigger effort, I think is a good thing for folks.
We are so grateful for KHDA's support at the LHD Academy of Science and the 61 local health department members that really have developed a culture of sharing measurements, and really putting each other's needs first in working together. Would you have any, what would you say to other national partners or funders that have given the grants, maybe even NACHO or FAB or CSTE or different divisions within the CDC? Would you give them any advice, or what would you say to them about the work that this group of data collection individuals have undertaken?
I would say that this is a very grassroots effort, that, in our state, every single local health department is involved. I think there's tremendous opportunity here to get a lot of gain for not a lot of money. It helps, like I said, we were all working in our own little health departments here in Kentucky, little and big, doing our data collection until AOS. I mean, and AOS is the thing that brought us together, to share all of that. And so, I think that if you're trying to affect what happens in local communities, which sometimes is hard from the national level, this is a great way to do it.
Awesome. Thank you so much, Dana. We appreciate your time.
Sure.
We really,
I'm always happy to help in any way. So just feel free to reach out anytime.
well, we just really appreciate the culture that you have created across the state. I know that our local health departments are so appreciative. I remember when we launched with 15 local health departments, they were like, hey, I want to be involved, but I don't have finances, but I will give, I will participate, I will do whatever I can. And I remember when the state came forward and said, you know what, we will support. And I remember having that first meeting with you. You were like, yeah, let's jump to it. And to be honest with you, the culture is everyone. Like I tell everyone that, I go, what's happening in Kentucky can happen across the nation. And it's the leadership of each person lifting where they stand. So we really appreciate it.
And we're lucky. I mean, I think that our SACHO is really strong. So that's really helpful. I think, it allowed us to kind of hit the ground running here, I think, in that we already had a strong SACHO where the local health departments already had a lot of rapport with each other, and they already had this like spirit of collaboration. And it fit a need that we had. So it was a no-brainer.
Yeah. Thank you for your time. Appreciate it.
Great, thank you. Bye.
Bye.